Assalamualaikum and hi everyone. This is the second part of my types of drug therapy, which I will be discussing on side effects. So side effects are actually unfavorable bad effects, any seen effect which is not a therapeutic intention. So it can be worsening of illness, condition or effects seen of unspecific side. And there is a range of side effects unintended and occurring at normal dosages of drugs that cause mild to severe side effects, including anaphylaxis. I think the topic of side effects will be discussed, or adverse effects will be discussed more by Prof. Sharida. So mine is just only the superficial aspect. So a drug side effect is undesirable secondary effect which occurs in addition to the desired therapeutic effect of a drug or medication, and often occurs with drugs with low therapeutic index, which is very dangerous. And I think you will learn about therapeutic index by Dr. Niza and Dr. Haniza. And therapeutic index is a drug which have a narrow margin of safety and high danger of producing a toxic effect. And usually drugs with unselective action also has an increased risk of drug side effects because they have many actions. So sometimes they can become worse. And drugs which act on many receptor symptoms are also one of the criteria which can easily causes side effects. So examples of drug side effects will include inhalant forms of anti-asthmatic drugs, which may cause dryness or irritation in the throat, dry mouth, or an unpleasant taste in the mouth. And side effects of antidepressants include urinary retention, blurred vision, constipation, sedation, which can interfere with driving or operating machinery because you can sleep while working, and it can also cause sleep disruption, weight gain, or headache. It can also cause nausea, gastrointestinal disturbance, or diarrhea or abdominal pain, and inability to achieve an erection or orgasm for men and women, loss of libido, agitation, and anxiety. These are all side effects of antidepressants. Side effects may occur due to pre-existing abnormalities, for example, liver disease or compromise in renal function. This is because when you have a liver disease or renal function, there will be a reduced metabolism and excretion of the drug. So there will be an increased plasma concentration of the drug, causing a possibility of having side effects. An adverse drug reaction is an expression that describes harm associated with the use of given medications at a normal dosage, and may occur following a single dose or prolonged administration of a drug, or result from the combination of two or more drugs. Factors contributing to drug effects are, for example, disease states. Various diseases, especially those that cause renal or hepatic insufficiency, may alter drug metabolism and excretion. Okay, and genetic factors. Amongst the factors involved are abnormal drug metabolism, which may be due to inherited factors or either phase 1 oxidation or phase 2 conjugation, as has been explained by Dr. Sandra. Inheriting abnormal alleles of cytochrome P450 can alter drug metabolism. That will be discussed further by Prof. Johnson. And tables are available to check for drug interactions due to cytochrome P450 interactions. And inheriting abnormal butyryl cholinesterase or pseudocholinesterase may affect the metabolism of drugs such as succinylcholine. I think Dr. Haniza also will be discussing on this, as also Prof. Rosliza in the future lectures. Inheriting abnormal N-acetyltransferase, which conjugated some drugs to facilitate excretion, may affect the metabolism of drugs such as isoniazid, hydralazine, and procainamide. Factors contributing to drug effects, continuing on, is also interaction with the other drugs. The risk of drug interaction is increased with polypharmacy. When there are multiple drugs given simultaneously, thus the risk of adverse effect becoming higher may be really real. And another possible effect is the protein binding effect. These interactions are usually transient, mild, until a new steady state is achieved. And these are mainly for drugs without much first-pass liver metabolism. The principal plasma proteins for drug bindings are albumin, alpha-1 acid glycoprotein, lipoproteins, which I have discussed in my lecture notes on absorption and distribution. Kindly read up on that, especially on protein binding. And some drug interactions with warfarin are due to changes in protein binding. So the risk of protein binding also causing possible side effects are very high. Okay, we've talked about side effects. Now we'll talk about cumulative drug effect. Okay, definition: cumulative drug effect is the condition in which repeated administration of a drug may produce effects that are more pronounced than those produced by the first dose. A cumulative drug effect may be seen in those with liver or kidney disease because these organs are the major sites for the breakdown and excretion of most drugs. Example, the renal toxicity of aminoglycoside antibiotics. For example, gentamicin or neomycin, okay, which is greater when administered as a constant infusion than with intermittent dosing. It is the accumulation of aminoglycoside in the renal cortex that is thought to cause renal damage. Okay, so the result produced by accumulation of drug in the body can be either first in the form of additive effect, which is the combined effect produced by the action of two or more agents being equal to the sum of their separate effects. Or it can produce an adverse effect, which is a symptom produced by a drug or therapy that is injurious to the patient. So it can be either for the good of the patient, which is an additive effect, or it can be bad for the patient because it produces an adverse effect. So a cumulative drug effect may cause two of these reactions. So causes of cumulative effect of drugs is usually due to too frequent doses or due to too long continued administration. I think this topic will be explained further by Prof. Sharida in her future lectures. Example of cumulative effect of drugs are like chemotherapy cumulative effect. With each chemotherapy infusion causing side effects such as neuropathy, fatigue, which will get worse. Okay. And besides the side effects, the cumulative effects, there are other drug effects that we will discuss, which is tachyphylaxis, which is the rapid appearance of progressive disease in response to a given dose after repetitive administration of drugs. Secondly, we'll talk about tolerance, which no longer responds to the drug in the way that initially responded, need a higher dose of the drug to achieve the same level of response achieved initially. We'll talk about drug abuse, which is the use of illegal drugs or the use of prescription or over-the-counter drugs for purposes other than those for which they are meant to be used or in an excessive amounts. Drug abuse may lead to social, physical, emotional, and job-related problems. Okay, now we'll be talking about tachyphylaxis deeper in context. So the effect is common with drug acting in the central nervous system disease. The pharmacodynamic mechanism, if you remember what is pharmacodynamic? I think you know right by now. Pharmacodynamic is what the drug does to the body. Okay. Pharmacokinetic is how the body affects on the drug. Okay. So pharmacodynamic mechanism possible causing tachyphylaxis is usually depletion or marked reduction of the amount of neurotransmitter or depletion of receptors available for the drug or neurotransmitter to bind. Okay, that is pharmacodynamic mechanisms. While pharmacokinetic mechanisms is induction of the metabolic enzymes, which causes an increase in the metabolic breakdown of drugs. See how the body acts on the drug. Pharmacodynamic is how the drug acts on the body. Okay, right. I hope I'm not confused. I hope you're not confused. Okay, if you're confused, read back your lecture notes on pharmacokinetic and pharmacodynamics. It can be very confusing. Sometimes I get confused too. Okay, so cardinal features of tachyphylaxis is usually first, repeated administration of the drug, same dose given every time, with diminished physiological effect with time, and it only develops over a short period of time. Maybe a few days already you can see that the effect of drug is not working anymore. And it is actually not dose dependent. In short, when you give a larger dose of the drug, it may not restore the maximum or therapeutic effect. That means no therapeutic effect is seen anymore. And it is rate sensitive, which may require frequent dosing to get similar effect as before. Okay, so that is tachyphylaxis. And the mechanism involved in tachyphylaxis resemble those of tolerance, okay, which I will explain later. And with the exception of the fact that it is usually impossible to withdraw and reabsorb or synthesis and express receptors with that sort of speed, because tachyphylaxis occurs within minutes to days, maybe 1 day or 2 days, while tolerance develops within 2 or 3 weeks. But the features are almost similarly the same, only the duration is different. Okay, I think that ends our second part. I'll see you back in the third part. Bye and take care.